So disclosure, there's one product I'll show at the end that I'm an investor in, and I'll make that clear when we get to that point. So, when we're talking about management of rotator cuff tears, we've seen primary rotator cuff repairs, rotator cuff augmentation, and then interposition. I'm really going to focus on the augmentation piece. So you heard how to do that biologically with non-structural biologics from Brian, and from Rafi you heard about dermal grafts, and we're going to talk about synthetic grafts. So we did a meta-analysis some time ago. You've heard a few of these so far. We're not the first person to do it, and we won't be the last. But the bottom line is these augmentation for rotator cuff works. It decreases the healing or decreases the re-tear rate. It also improves ASCS scores. In the case of synthetic grafts, where they've done more in Europe, it actually improves the constant Murley score. So there is good data for the use of these. Obviously, we talked earlier about the cost effectiveness and when to use it. So again, you can see here synthetic grafts in this study, about synthetic and allograft had about 80% healing in this group, and no augmentation about 50%. So depending on the study you read, you're going to get different numbers, but time and time again, we do see a reduction in re-tear rates with those. Functional outcome scores, as I mentioned, augmentation or interposition, higher post-op ASCS scores in this meta-analysis. So, what are the different materials? So we talked a little bit about that. They can be xenograft, they can be allograft, they can be autograft, right? And then obviously pure biologics. I'm not going to go through these, but just to show, there's a lot of data on synthetic grafts. Again, not something that's used a lot over here in the US, but very common in Europe. A lot of good data show, and some of these studies going out to 20 years, 10 years. So this is something that is a tried and true technique that I think is the kind of the next thing to come from across the pond. So I'll skip this in the interest of time. Here's one patch that